The countdown is on. This website shows you the years, days, hours, minutes, even seconds until a very important deadline. A deadline to end breast cancer.
I have a sense of urgency. I have granddaughters and nieces, and I'd like to see this happen.
Vernell Branch wants to help her grandchildren avoid the disease she was diagnosed with in 1996. The survivor and advocate is part of an unprecedented push to wipe out breast cancer by January 2020, a deadline set by the National Breast Cancer Coalition.
We want to focus on those two areas of stopping it before it ever starts and stopping it before it spreads to other body parts.
Branch says while there's greater awareness from events like Race for the Cure and better treatment, she says NBCC wants more. First, it's challenging scientists and researchers to create a vaccine to prevent breast cancer.
It gives us a good motivating factor to have a deadline.
A timeline gives doctors something to shoot for, and that appealed to many women I talked to.
I think that setting the deadline is a good idea because it kind of puts the pressure on to actually come to some kind of conclusions.
It gives them a goal, something to work toward.
I'm not sure if they'll be able to meet it, but it certainly is a motivation.
But Massey oncologist Dr. Mary Helen Hackney says creating a vaccine over the next decade will be difficult.
The hard thing is there are probably multiple drivers for breast cancer. So finding one thing that's going to work in everybody may be the challenge.
Second, NBCC wants to prevent the disease from spreading, which kills many patients. Dr. Hackney says drugs like tamoxifen and raloxifene are having success in preventing recurrence, which can lead to metastasis. Even if scientists don't meet the deadline, Dr. Hackney says women should not give up hope on a cure.
It'll come. It will come. So the question is when.